Okay, so I'm very excited to be joined by my next guest. I contacted a man who, I'm not sure if he's aware of this, but in Ian Dale's book, Why Can't We All Just Get Along, he's described as a man who absolutely everyone always gets on with. Extremely excited to be joined by Mr. Robert Halfon, Chairman of the Education Committee and MP for Harlow. Mr. Halfon, how are you, sir?
I'm very well, thank you. Nice to be on your programme.
Thank you
and
so
nice
much.
to speak to you again.
Yes, you too, sir, you too. So I'm going to go straight into it because I know that you are a busy man. So we now have the 15 million most vulnerable have now been vaccinated. Is it time to reopen schools?
Well, I hope very much that schools will reopen on the 8th of March, as the Prime Minister has said, because the last year has been pretty tough for our nation's young people. I described it as the four horsemen of the education apocalypse galloping towards our children, because we know there's been, despite the efforts of brilliant teachers and support staff, there's been a huge loss of educational learning. There's a massive increase in mental health problems amongst young people. There is also safeguarding hazards that some of them have faced, exposed to online harms, exposed to county line gangs, exposed to very tough situations possibly at home. And finally, we know that the Institute of Fiscal Studies have said the school closures mean that the average young person might lose around £40,000 over their lifetime in lost earnings or lost wages. So this is pretty bad. So we need to get the kid back into school, especially now we've got so many, the elderly and the clinically vulnerable, almost vaccinated.
And do you feel, so obviously I know that there was a report that came out yesterday from Public Health England claiming that they believe that primary schools were safe. Do you believe that both primary schools and secondary schools are both safe at the moment to go back on the 8th of March?
Well, I've made it my business to follow the official science. And the reason that I just made that decision was because I'm not an epidemiologist, I'm not an expert. So to me, if Public Health England is saying primary schools are safe, if, as other studies have come out today, scientific studies recognised by the government have come out that schools are not responsible for major transmission, thank God, of this awful disease, and that teachers and support staff, thank goodness, are at no greater risk than any other profession, I think, given the harms that I've just mentioned to you in terms of children, most children not being at school, we should do everything possible to get our schools open again on the 8th of March.
Okay, and you were saying there that you that the it's come out that teachers and support staff are at no greater risk than any other profession. Do you believe that we should be vaccinating as a priority teachers and support staff?
Yes, so the Chief Medical Officer said this, that teachers and support staff were at no greater risk than any other profession. Thank goodness. Having said that, the problem is that if a teacher or support staff member gets the COVID, even if it's just a moderate case and one or two teachers get it, it means often either the school has to close, a year group has to go home, a bubble, whatever you want to call it. And so what I want to see is once the schools open, they stay open. And the answer to this, I think, is that once we've done the clinically vulnerable and the elderly and anyone at risk, and I'd like people with learning disabilities to be moved up the priority list as well. Once we've done all that, let's ensure that teachers and support staff are vaccinated as a high priority, not because they're a special case, although I think teachers and support staff are so incredibly important, because education is the most important thing we can do in our society for our young people, but because I just want the schools to open and to stay open. And if that helps, it's well worth it.
Excellent. No, I completely agree with you, sir, and I think that is a priority that we as a country should look to, and I think that the government is right when they say that schools are the priority that should be open first. Now, I'm not one of these people who, obviously, we do have quite a harsh and strong and a very sad death toll in this country. Now, I'm not one of the people who holds the government completely responsible, but one of the criticisms that I've always had are the borders. Now, do you think that we should have shut the borders in the beginning, as Priti Patel and Matt Hancock advised, or do you think that the Prime Minister was right to keep them open?
So that's a really important question, because when all this started at the beginning, you do wonder, last year, before we knew what it was, and no one had any idea, and none of us thought it was going to spread around the world, and the millions of people would lose their lives. I did wonder why we didn't close the the borders at the very beginning. And the problem for us is, whilst great countries like New Zealand have been able to do it, and I have massive respect for the Prime Minister there, is that we are a country that has hundreds and hundreds of thousands of people arrive in England every day. That, you know, a significant part of our exports and imports come from overseas. You know, we have loads of imports coming in every day. And so just loads of people coming in for business reasons. So for a country like ours, that is an international hub, that is the centre of so much activity across Europe, it's very, very difficult just to say shut the borders. And the other problem is, of course, you know, we live near Stansted Airport, you and I. Stansted Airport is a great airport. They have thousands and thousands of people employed. There's many jobs. They have they've employed many apprentices, something I care about very deeply. And these airports are on their knees at the moment because of what is going on. And so you have to walk the balance between the tightrope of actually, yes, trying to make sure that people don't come here with disease, but also not destroying thousands of jobs in our economy. And that is a difficult one for the government. I welcome the new quarantine measures, and maybe that could have been done earlier. The testing, everyone should be tested as they arrive, wherever they come from. We have got bans. I think we're about 33 countries which have got high COVID, you know, including Brazil, where there's that big variant. And mainly the people coming here at the moment, I think they've reduced it from hundreds of thousands to between 15 to 20,000 a day, if not lower than that. So I'm not trying to give you a politician's answer, but there is no easy answer to this. But perhaps, if looking back with hindsight, maybe if we closed the borders straight away, but I think that no one understood what this disease was or what was going to happen.
Yeah, no, I completely agree. No, I am one of these people who I can understand where you're coming from, and I do understand that obviously we do have a huge population. We are a massive travel hub where people come into work and to travel, and I do understand the issues with closing the borders, but I also do feel as though with the issues of new variants, that could put. Now I know that at the moment, with the information we've been given, the vaccines should still be effective to the point of stopping hospitalisations and deaths, hopefully. But I just think that maybe having slightly tighter border controls could benefit to make sure that we return to a normality as quickly as possible. Now, obviously, as well as the health crisis, we are going to be in a financial crisis for quite some time. I had Dennis O'Sullivan, the headmaster of Chauncey School, on earlier, and he was speaking about how he feels as though the NHS are, consistently underfunded. Now, obviously, in the last manifesto, which the government were elected on, they were talking about further funding for the NHS, getting more nurses in, building more hospitals. With the financial crisis that's ahead, are we sure that that is not going to affect the NHS?
Absolutely not. I mean, the government, I think, committed an extra 20 billion to the NHS. There's been many more billions spent on the NHS, rightly, during this awful pandemic. I mean, I believe there is an umbilical cord between the British people and the National Health Service. I would fight for it to my dying day. And I've been very lucky to have been treated from it because I had problems with my legs at a very young age. So what I absolutely believe the government is going to meet its manifesto commitments and will continue, and is actually meeting them much more by spending a lot more than the NHS and anyone ever envisaged. I mean, the figures are eye-watering if you look at them in the round. So, of course, it will never be enough. There'll always be more money needed for the NHS. I think the public want the NHS as it is. I don't think they want to change to any kind of private or insurance system. And we have to have a contract with the public to say, yes, this is the money we're going to spend. It may affect, spending in other areas, but it's what the public want us to spend money on.
Yeah. Okay, I'm glad to hear that, sir, and I do hope that with the financial challenges that come, I do hope that the NHS is still continue to be funded to the high level that I am now seeing going into it, and I hope that also the doctors and nurses continue to be taken care of financially as well. Now, Sir Charles Walker, what made quite a bit of stirrings. I think a lot of people to what he said quite well, and considering I know that Twitter is a dangerous place for politicians from all parties, but he seemed to get quite a good response when he was saying that we cannot cancel life to preserve life, and that the current situation that we are in with lockdown isn't sustainable for people's mental health or emotional well-being, and he says that we do need to learn to live with a certain amount of COVID deaths. Now, is he right?
I love Sir Charles Walker. He's my constituency neighbour, and he could not. I know him very well. He's one of the kindest, most dedicated MPs you could ever want to represent you, and he's always helped me even when I was a candidate. Before I was elected to Parliament, he's just one of those people who just tries to do good all the time. I think that he speaks. If you imagine this is a heart and head argument, I imagine he speaks to the hearts of thousands, if not millions, of people, because this tightrope is a really tough one. Because on one side, you've just been talking about the NHS. You've got to protect health, protect the NHS, and make sure this virus doesn't spread with the new mutations. One of them, which is in the nasing areas, I understand, of South Africa variant, but thank goodness only a small amount. But and on the other side, you've got to think about people's livelihoods, their jobs, the economy, their mental health, their well-being, and without a doubt, he is right that people have really struggling with this, and I see it every day. I meet and talk to businesses who are losing their businesses or losing their livelihoods. People who've lost their jobs. So we have to make sure, and that's why I say Charles Walker speaks with the heart of so many people during the lockdown, that we have a route map that out of this, that I've said that what the Prime Minister should do, or number 10 is, should go down to Halford's in Harlow if need be, buy the best GPS system ever invented, and give us a direction of travel out of this coronavirus. Now we have so many people vaccinated, because people need hope. They need to see that there is an end to this, and that this lockdown will be the last one, because I don't think if we all come out that people will sustain being locked up again at home, and it's damaging to business, it's damaging to people's mental health, it's damaging to kids, as we talked about earlier in your interview, and we've got to get out of this as soon as possible.
I completely agree with everything you said there, and I must say I do agree with Charles Walker as well, and it sounds as though you're on a very similar path to what he was saying. Now, with this roadmap that we're hopefully going to be getting in only just over a week's time, do you think that we will see that roadmap that will lead us back to normality, or do you think it will lead us back to a certain restriction based?
Well, anything is better than nothing. I'm not I'm happy with incremental changes, but the sooner the better, but particularly just helping people's jobs and livelihoods.
Yeah.
I would also like a change made. That at the moment we're not allowed to see any friends or relatives unless it's outside for an hour in very strict social distancing. I don't think you're even allowed to sit on a bench at the moment with another person. I may be wrong about that, but it's pretty strict. What I hope very much is when the restrictions are lifted, they allow one bubble to be designated per household. So, for example, let's say you were my bubble, you'd be the one friend that I would be allowed to go and see.
Yeah.
And I think that is very important, because it's not just family, but people are really missing their friendships. And I'm not bothered about masks and social distancing. I can't stand wearing masks, but I don't care that if we have to wear them for a while yet. I don't mind if we have to social distance either. But what I do think people want to do is to be able to meet up at least, and meet. Surely they can make the restrictions a bit better when we come out of this lockdown, to at least say at the beginning you can meet with one other household. You designate one household, and And I think that would be quite reasonable for the government to consider. I think it would make people feel a whole lot better that things were, things were at this awful time is ending for us.
Absolutely. Mr. Halfon, thank you so much for coming on. I know that my listeners will appreciate it, and I very much appreciate it. Thank you so much, and I hope that you will come on again in the future.
I'd be delighted, and thank you.
So there we have it, Mr. Robert Halfon as the first politician to enter conversation with Chris. Now, I'm extremely grateful to Mr. Halfon for coming on, and I also must say, I hope he doesn't mind me saying this, but back in 2019, when the Brexit withdrawal agreement came about, he was very, very good, because I had some genuine, very big concerns about it that I was very worried about, and I had absolutely no relevance to political journalism. I still don't really, or anything like that. But he still invited me to Parliament. We debated it, we went through it, and he gave up a lot of his time to discuss it with me. And I'm genuinely grateful that he is always happy to give me some of his time whenever I ask for it. So hopefully Mr. Halfon will return on Conversation with Chris in the future.